In 2021, more than 530 million people had diabetes. It's almost 8 times the French population. I think that's time for us to learn a bit more about it. The word diabetes comes from ancient Greek dia, which means through or across, and from baino, which means to walk or to step. It literally means to pass through, because Egyptian Medici noticed that some people seemed to urinate as soon as they drank water. But what is diabetes concretely? Well, it can be two things. Either a body disorder defined by a high quantity of sugar inside the blood and inside the urine, called diabetes mellitus, or a condition in which you will excrete enormous quantities of urine. This one is called diabetes insipidus. Diabetes mellitus, literally honey diabetes, has been discovered after the Medici noticed that urine had a sweet flavor after tasting it. In diabetes mellitus, the body struggles to produce or to recognize insulin, an hormone that allows to lower the blood sugar levels when secreted. The diagnostic involves analysis of blood after fasting for at least 8 hours, and the 3 symptoms of this diabetes are polyuria, excessive urination, polydipsia, excessive thirst, and polyphagia, excessive hunger. There are 3 main types of this sweet pea disorder. The first is called type 1 diabetes. The pancreas, where insulin is created, stops producing it partially or totally. Most of the time, it's an autoimmune loss of ease that involves immunity cells destroying the cells that produce insulin. Type 2 diabetes is basically the insulin resistance of your body cells. The cells basically stop recognizing insulin, but insulin is still created inside the pancreas. The body being lazy though, will stop producing insulin after a while, seeing that the cells don't use it. And last but not least, gestational diabetes mellitus. It is the type 2 diabetes of the pregnant women. The pregnancy hormones cause insulin resistance mainly because their role is to raise the blood sugar levels. But the GDM is usually temporary and disappears after childbirth. Diabetes insipidus has nothing to do with insulin or sugar. Indeed, when you taste the urine, it is not sweet, but insipid, tasteless. It's a different hormone involved called antidiuretic hormone, literally, the hormone that doesn't make you pee. Here, this hormone is either not produced or less produced by the hypothalamus of the brain, or the kidney becomes resistant to it and won't react when being stimulated. In both cases, you will urinate a lot, up to 20 liters a day, the equivalent of 20 bottles of water. Diabetes insipidus is more disturbing than dangerous, only if you drink a lot of water, your neurological center of thirst works well, and you're not in coma or unconscious. In the 7th century, Chinese already proposed a treatment similar to the ones we have today. Abstain from drinking alcohol and from eating starch, which is a complex sugar. I'm convinced that diabetes is not a permanent loss of ease. Working on nutrition and on the organs involved can lead to a return to normality. You can click on this video to learn more about blood. Thanks for watching. See you soon. Bye. Abstain from drinking alcohol and from drinking starch. No, the pregnancy hormones to learn more about blood. You can